Welcome to Changing Higher Ed, a podcast dedicated to helping higher education leaders improve their institutions. With your host, Dr. Drum McNaughton, CEO of The Change Leader, a consultancy that helps higher ed leaders holistically transform their institutions. Learn more at changinghighered.com. And now, here's your host, Drum McNaughton.
Thank you, David. Our guest today is Dr. June Parks, a licensed clinical psychologist who's worked with children, adolescents, and adults for the past 20 years. Dr. Parks specializes in child psychology and trauma and has helped multiple universities and their student service professionals enhance student, staff, faculty, and individual well-being, as well as improve engagement and professional satisfaction and prevent burnout and staff turnover. In today's highly charged, pressure-packed climate, it isn't if, it's when will someone at your institution need help. And June is here to give us some tips on how to recognize and deal with mental health issues. June, welcome to the show.
Thank you, Drum, for having me. I'm very excited about our conversation today.
I am as well. And, you are an expert when it comes to mental health, especially for K-12 adolescents and college students. And we've got so much of that going on. I mean, a day doesn't go by that I don't see another story online about another crisis, mental health, whatever it is throughout the country, and especially at our colleges and universities. What's going on?
Well, we've had our U.S. Surgeon General who came out at the end of last year with a declaration, unprecedented declaration advisory that youth mental health has reached crisis level. So you're not imagining this. I think that historically we have struggled, meaning our young people have struggled with mental health for years. Our college students historically have been found to struggle with anxiety and depression and stress. And then we had a little thing called COVID-19 and a global pandemic occur. And through all kinds of curveballs for lots of us, but for our college students, they found themselves abruptly having to leave their universities and campuses and, say goodbye to familiar friends and routines and pivot into this new way of being a student that I don't think any of us saw. And it has created additional unique challenges for our college students and for our young people in general, and probably also for our adults.
Oh, I think for everybody, just being completely ripped out of a situation where you are, and everyone is terming it, oh my gosh, we have this crisis going on. First off, people have challenges dealing with crises. They do. It's something different than what they have ever had to do before. And who's ever had a pandemic? I mean, the last time we had a pandemic was in 1918, the Spanish flu.
Yep.
And so it's no surprise, but it also seems like we're recognizing these type of things much more than we used to. Is that a fair statement?
Well, I think there's research that suggests that, start with our Gen Z generation. So that's individuals born between 1997 and 2012, that they are overall more receptive to seeking mental health supports, going to therapy in a way that the generation maybe before them, our millennials, aren't as much. And the millennials are better than for my generation, which is the Gen Xers, are willing to seek mental health supports. And my generation does it a little bit better or is a little more open to it than the baby boomers. And I think there are a couple of reasons for that. There are, I think overall for our Gen Z population, an openness and an awareness of mental health issues and a reduction around the stigma. And I'd like to believe that our generation, these higher, older generations have kind of helped pave the way for some of that awareness. But I do want to make just one caveat when I say that. I always want to make sure that we don't fall into a blind spot to feel that just because our Gen Z population are willing and open to talk about and to seek therapy supports, that we don't get lulled into a belief that, if there's something wrong, they will tell us. If they're not mentioning it, then there are things going on. And that, I think, is a rabbit hole or a belief system, an assumption that isn't helpful, because there's so many individual group differences. And also, I think there are also mental health challenges that people can be a little more reticent to talk about, whether you're an adult or sincere, like things like suicides and self-harm.
So before we get down to start talking about symptoms and how, administrators recognize these kind of things, answer a question for me. Are there more stressors that are triggering mental health challenges now than there used to be? Is that a rabbit hole we don't even want to go down?
I think it would be a healthier conversation to think about that there are different challenges.
Okay.
And I don't know how helpful it is to compare my generation's challenges with the Gen Z generation's challenges. There are, without a doubt, all kinds of unique challenges that I look at and say, boy, I'm kind of glad that I haven't had to deal with some of these things when I was going through college. And
like online bullying, for example.
Right. So that has been something that has caused, as I said earlier, historically, our college students have experienced all kinds of stress and depression for decades, for generations. And a part of it has been related to things like pressure to succeed, worry about financial issues for our college students who are watching tuitions and student debt rise. But yes, technology, harassment, cyberbullying wasn't something that was around a generation ago. That absolutely is causing all kinds of challenges for our college students and our young people.
Yeah. And you bring up some excellent points, the financial aspects of college. Students, especially lower income students, are going into debt. They're wondering, are we ever going to be able to repay this? I mean, I had a couple of guests on a week or so back, Catherine Campbell and Artem Gulish, who were talking about the differences of the younger generations not finding that good job coming out of college sooner. And if you're coming out with greater debt and not finding a job that's financially stable, I mean, that's huge stressors as well.
Oh, absolutely. Absolutely. I think a generation ago, a bachelor's of arts, a bachelor of science degree, particularly in certain industries, were solid, would mean that people could feel comfortable about entering the workforce with a steady income that was going to be able to support a lifestyle, which feels a lot different with this current generation.
And I would go as far as to say that many of your millennial and your Gen X administrators, they can somewhat relate to the challenges that this generation, the Gen Z, have, but in other ways they're not really able to, because they may not have the same kind of student debt. They may not have the same kind of changing of jobs that happens as frequently there is. So the stressors, whereas there's a lot of the same, there's a lot of different stressors that people can't necessarily relate to.
Absolutely. No, I would absolutely agree with that. And just to maybe add another stressor or another challenge, when we start to think about our BIPOC students who are Black and Indigenous people of color, and how COVID has impacted our BIPOC communities in a way that has been devastating, that adds additional challenges for our BIPOC students, but also BIPOC students are also navigating challenges regarding racism and those things that are going on both in our society as well as in our institutions of higher learning. So they're, again, long-standing issues, but occurring currently now in unique ways that are continuing to create challenges.
You're spot on with that. There's so many different ones. Let's swap horses just a little bit. As an administrator, what should you be looking for from a symptoms perspective that might give you an idea to say, this particular student or this group of students are struggling a little bit? What are some of the warning signs that you might see?
Well, I think the major warning sign for me, the one that
the red flag neon light, yeah,
exactly, has to do with an individual's difficulty or struggle around keeping themselves safe. So I'm talking around suicide, around wanting to hurt themselves, kill themselves. That is something that I think most of us practitioners, clinicians catch our attention and we jump into action to focus around. However, there are other things that also catch my attention. A lot of it has to do with a student's ability or a young person's ability in terms of functioning, engaging in their activities of daily living. There are ways in which mental health really can be debilitating on some of these things. We're talking about depression and anxiety. Depression is a cluster of symptoms. Anxiety is a cluster of symptoms too that revolve around depressed mood or tearfulness, lack of concentration, feelings of low self-worth, suicidal ideation, and all that can really impact one's ability to function in the way that they would want to. Anxiety is also a cluster of symptoms. We'll see it in terms of intense worry or fear. It also has physiological symptoms regarding, heart palpitations and sweating and shortness of breath that people may think, oh my gosh, am I, having a heart attack? But panic can look like that.
Mm-hmm. Yeah. And so, some of these things are recognizable by other folks, but some of them aren't.
Mm-hmm.
The one that we talked about when we spoke last that really had me concerned was the opening of Pandora's box and what you termed the pop-off moment.
Yeah, so I have a specialty in the area of childhood trauma. When I was talking about the Pandora's box, for me, I was really just kind of describing my entry into why I do the work that I do in trauma. I've over the years had the opportunity to meet some remarkable young people who had some devastating events occur to them. And they trusted me enough to share these experiences and to believe that we could find a path towards healing through their trauma. But once I heard their stories, I could not unhear it. It was this Pandora's box that I couldn't close, and felt very inclined to continue to be of service and help. And that's what I've been doing for the past 20 years. In terms of the pop-off, I really kind of got that from a psychiatrist named Dan Siegel, who was really an expert in brain functioning and brain development, particularly around the younger youth and adolescent age group. And he talks about the function of the brain, kind of breaking it down in layman's terms. He talks about there's a downstairs part of the brain, which is the limbic system, and that houses all of our emotions. And there's an upstairs part of the brain, which is the cortex, which its job, among other things, is helping to manage our emotions. And what can happen, particularly with adverse life experiences like trauma, the downstairs brain, the limbic system, gets these impulses of emotions that continue and continue and continue until a point that the cortex, the upstairs part of the brain, has difficulty managing. And the cortex is holding on, trying to maintain these intense impulses, but eventually there's a pop-off. I think Dan Siegel calls it a flipping the lid. And I think most of us can relate to some of that experience. And part of what therapy is around helping people who can have this very normal human experience, figure out how to manage their emotions so that it doesn't reach this pop off or flipping the lid level.
Mm-hmm. And I would be willing to bet that some of these shootings that we've seen is folks who have had this pop off moment, and they know right from wrong on some level, but they've just allowed their emotions or whatever ideology they believe in, they've allowed it just to run away with themselves.
You're talking about the offenders, the shooters?
Yes.
Yeah, I'm imagining in my world, there usually isn't one answer or one explanation for anything. My life, and I see life as so nuanced.
What? No silver bullets? Come
No,
on.
I wish we work really hard as humans to find that one answer. In my world, at least, it doesn't exist.
Yeah.
I think there could be a part of that going on, but there are probably so many factors that are contributing to what
causes these things.
Yeah.
There was one book that had and I know we're getting a little off track here, and we'll get back to it, folks.
Yeah.
There was one book that I read as I was going through my doctoral work. It was by Robert Bly. It was called A Little Book About the Human Shadow. And it talked about, we all go around with this bag of stuff that we carry on our shoulder. And every time we get a hurt or a slight or whatever, we throw that piece of ourselves that got hurt into the bag. All of a sudden, this bag will explode if we don't take care of it through mental health or whatever. And when that happens, stand by.
Absolutely.
Can you spell pop-off moment? Can you spell, something like that?
Absolutely. I think that we tend to want to fool ourselves to believe that we have this endless amount of capacity, endless amount of time, and endless amount of energy, that we can just continue to, as the example that you're giving, internalize all of this hurt, pain that we may be experiencing in our backpack, or you're calling it a bag. I actually call it a backpack.
That's good. That's more modern.
But there's a limited amount of capacity. And if we don't find ways to titrate some of these emotions, experiences in healthy ways, there's no room other than the pop-off moment.
Exactly. So from the perspective of the students, how does this impact students as they're going through? I mean, I can just imagine, you get less motivated to do your studies, you become depressed, you stay in your dorm room, et cetera. What happens? How does this present from a student's perspective?
In terms of mental health challenges?
Yes.
Just like adults, it can look all kinds of ways. I do think that there are, it can look, again, as we said, life is nuanced. So I wish there was, these three ways in which college students are going to show mental health challenges. But what I am encouraging people who are working in spaces with students is to be curious and to ask questions and not fall into the assumption that if a student is struggling, they're going to tell us, or even if a student is telling us they're okay, that's accurate. That we need to really be having conversations with our students. And if there's something intuitively that's telling us something's off, even if we have no data to support it, I want to encourage people to trust it. Even if it's a off intuition, right? We'd rather err on the side of caution.
Sure. And we need to train people on to how to have these conversations.
Absolutely.
It's not one of these things that you have a male professor and a female co-ed, and you're asking, particularly personal questions. You've got to approach it in the proper way and refer to the advisor, what's going on, which means you have to have trained advisors.
Right. These conversations aren't for everybody. Conversations around suicide may not be for all of us to have with our students that we're concerned about, but we need to name it and to talk to people who do have expertise in trying to help support students through depression, anxiety. So I think there is, I guess one of the things that's coming out as I'm talking right now is just really the importance of being able to talk about things that historically we could talk ourselves out of talking or want to minimize, and really just naming it, even if it may not be accurate.
I think that's really important. Do it in, obviously a respectful way, et cetera.
Mhm.
But the thing, most folks don't stop and put student mental health together with persistence.
Mhm.
And if in fact students are suffering, mental health, they're having mental health challenges. I'm not saying suffering from poor mental health. They're having
Mhm.
challenges. We all do.
Absolutely.
If these aren't dealt with, it's going to be a persistence issue for the university.
Absolutely. Absolutely. And I think most of the high institutions of higher ed that I'm in conversation with are very aware. It's one of the top concerns among leaders in higher education, right up there with finance and those other kind of things that historically have been concerns for our leaders in higher ed. But I think the thing that I'm always wanting to add is the fact that it's not just the students who are struggling.
That's a really good point.
So there's a bigger conversation that if we're just talking about the students and not thinking about the impact of the people who elevate these students every day, we may be missing a piece of the equation.
I think you're absolutely right. At least once a week, I see an article in the Chronicle of Higher Education or Inside Higher Ed or somewhere else about faculty burnout. And
Oh, yeah.
this is a mental health issue. People are tired. They've been at it for so long, dealing with COVID plus all the other issues as well. There's not only the students, but you've got the faculty, you've got the staff as well. And
absolutely,
we also need, I think, to deal with attending to the needs of those people who are doing the heavy lifting around this.
absolutely. That's really my mission.
Yeah.
Is just to recognize that our students are absolutely struggling, and the people who are on our campuses who are invested in these students want to help and make a difference, but it's a tall ask. It is a heavy lift, and it comes with a toll. There are unrelenting and extreme demands that can come on to the student services or the student affairs, student wellness personnel, our faculty, our professors. And so we really need to be having a conversation about that as well, because I really think they're connected.
Yeah, I think you're absolutely right. And it's, one of the ways we can do this is, giving professionals their own time, professional development, flexible schedules, things like that. But I think just being aware that in a different way, people all suffer from these, I want to say all, a lot of people suffer from these kind of challenges. And for those of us in leadership positions, be aware that there may be someone in your group who's having challenges beyond what the normal challenges are.
Absolutely. And I think that's a fairly clear statement to make when you talk about the burnout levels that we're seeing in higher education, this conversation that's not only in higher ed, but there's a big conversation right now about the Great Resignation. And I think that speaks to all of this. There's something people, there's a toll and a cost that's coming from doing some of this heavy lifting. They're the jobs that they do every day and want to do and perform at its peak, at their best.
Yeah. And you bring up a really interesting point. I hadn't thought about is the Great Resignation isn't always about pay.
Mm-mm.
A lot of it is, but a lot of it just has to do with finding a job that they like, they feel comfortable in, and it doesn't burn them out.
Yep. Absolutely. Again, we don't have this endless bandwidth. It really is, I believe, impossible to give of ourselves. And we want to. People in these professions, helping professions, we want to be of service. We want people to do better. But it's not an endless bucket we pour from.
Yes.
And there's a breakdown at some point.
You've got to recharge your batteries. You've got to get away. Anytime somebody It used to be a point of pride. My gosh, I haven't taken a vacation in 5 years. It's like, you haven't gone out and recharged your battery in 5 years. That explains a lot. Thank you.
Exactly. Exactly.
You can't do that. June, this has been a fabulous conversation. We're getting to the end, unfortunately, and I want to really thank you for being on. Give us 3 takeaways for university presidents. What is it that they need to be aware of with all the mental health stuff?
Oh boy. Okay. So I guess summarizing some of what we've been talking about today, I really believe and would like higher ed leaders to consider that there's a connection between our student well-being and the well-being of those people, those professionals who show up for these students every day. That student well-being is connected to these professional well-being. Student success is connected to the success of these professionals, and that the better these professionals, I'm talking about student services and faculty, the better they're functioning, I believe the better our students are going to function. And so I guess just to end on this one, there is often a conversation that we'll have that wonders, are students ready for college? And it makes me think about maybe the other half of this conversation needs to be, are our colleges and the wonderful people who are invested in supporting and making up the college communities, are they ready for our students? So that would be my first takeaway.
I would say that's the second one.
Oh, okay. We'll call it this.
Yeah.
Go ahead.
The first one being things are tied together. The second is making sure your people are trained to handle the students, because the training, the professional development, and the whole issue around mental health is so critical for people to have specialized training on this.
Absolutely. Absolutely. And to have downtime to really kind of have time to invest in the unique needs, the unique issues, the well-being of these professionals who do this work.
Yeah. And I would also toss in there, you as administrators, take your time off, recharge your batteries.
Absolutely.
Because not only do you need it, you're an example for all those others who work with you.
Absolutely. Absolutely. I think this is a message that applies to just about everyone on our institutions of higher learning.
Exactly.
Yeah.
So June, what's next for you?
Oh, I am working on a training that I'm very excited about called Reimagining Well-Being and Resilience. It's designed specifically for higher ed professionals, but primarily in the student services space, student affairs, student wellness. And it's all designed to examine the personal and professional well-being of these professionals to increase the success for these professionals, their students, and their staff, to improve work satisfaction and reduce burnout, as we were talking earlier, and staff turnover. I believe that the key to really good trainings is that it's interactive. And my training is really loaded with a ton of applied learning experiences. We're getting real about and open about conversations that these professionals have. We're examining real life challenges. We're looking at how mindsets can either elevate or diminish the well-being of these professionals. We're using role play, which is one of my favorite parts of this, to really, role play is really great. I like it because it provides us with an opportunity we don't get in real life to pause, rewind, and redo, which is critical, I think, when we're developing new skills. But it also ensures implementation and deepens the learning.
Yeah, that sounds great. I look forward to hearing more about it.
If people who are interested in my approach and learning just more about it, please visit my website, which is juneparksphd.com. You can learn more about what I'm doing and what I'm excited about.
Great. Well, June, thanks so much for being on the show. I've really enjoyed our conversation. Look forward to doing it again sometime.
Oh, my pleasure. This was fantastic. Thank you for having me.
My pleasure. Thanks for listening today. And a special thank you to today's guest, Dr. June Parks, and for her sharing with us her expertise on combating the mental health challenges that our faculty, staff, and students are dealing with post-COVID. Our next guest, we welcome back Mike Goldstein, Managing Director of the Center for Higher Education Transformation at Titan Partners. Mike will be joining us to talk about how new partnership models in higher ed are revolutionizing how some institutions are providing quality education to their students. This is going to be a great program, and it's always great to have Michael come back and join us.
Changing Higher Ed is a production of The Change Leader, a consultancy committed to transforming higher ed institutions. Find more information about this topic, along with show notes on this episode at changinghighered.com. If you've enjoyed this podcast, please subscribe to the show, and we would also value your honest rating and review. Email any questions, comments, or recommendations for topics or guests to podcast@changinghighered.com. Changing Higher Ed is produced and hosted by Dr. Drum McNaughton, post-production by David L. White.